Most colon cancers don't hurt. That's why they're missed. They don't cause chaos. They change your pattern. Your bowel habits shift. They don't return to baseline. No emergency, no collapse, just quiet change. That's how time disappears. Caught early, 5-year survival exceeds 90%. Caught late, it can fall near 13%. Same disease, different timing. I'm Afsoon, a primary care provider. Stay with me. Colon cancer doesn't begin with pain. It begins as a silent polyp that can grow undetected for 7 to 10 years. It is one of the few cancers that gives you time, and screening uses that time to remove the threat before it ever becomes cancer. It doesn't start with pain, it starts with change. New constipation, unexplained loose stools, back and forth, no crisis, just repetition. And repetition is the warning. Early disease doesn't explode, it alters routine. Tumor location changes the signal. Right-sided cancers don't bleed loudly, they bleed quietly. No red in the toilet, just falling iron. Mild anemia, vague fatigue, that's the trap. In adults, especially men and postmenopausal women, unexplained iron deficiency is never benign. It demands evaluation. Left-sided tumors change output. Thin stool, visible blood, incomplete emptying, tenesmus. Persistence is pattern, and pattern catches cancer. Colon cancer isn't loud early, it's persistent. Pain is late. Unresolved change is early. When your baseline doesn't return, that's the warning. Your stool changes before the disease gets loud. Stool changes precede symptoms. Black can mean digested blood. Iron can darken stool. Persistent black needs evaluation. Bright red blood might be hemorrhoids, or not. Clay-colored stool suggests bile obstruction. Greasy, floating stool suggests malabsorption. Persistent, pencil-thin stool matters. The colon is a hollow tube. If something grows inward, space narrows. One abnormal day is random. A persistent pattern is data. Colon cancer builds slowly. So does protection. Higher fiber intake is linked to lower colorectal cancer risk. Fiber shortens transit time, feeds gut bacteria, supports colon lining repair. Protection requires diversity. Your colon needs different fibers because different fibers feed different bacteria. Onions and garlic deliver prebiotics that stimulate protective microbes. Apples and citrus provide soluble fiber that supports the colon lining. Oats and barley supply beta-glucan to regulate inflammation. Beans and lentils ferment into butyrate, the primary fuel for colon cells. Cooled potatoes convert into resistant starch when chilled, feeding beneficial bacteria instead of spiking glucose. Green bananas offer the same resistant starch before ripening. More fiber diversity, more microbial diversity, stronger colon, lower long-term risk. Aim for roughly 30 grams daily. If vitamin D prevented cancer the way the internet claims, we would already know. We don't. Low vitamin D levels are linked to higher colorectal cancer risk in large population studies. That signal is consistent, but in massive randomized trials, including VITAL with over 25,000 participants, high-dose supplementation did not significantly reduce cancer rates. That's the conflict. Vitamin D is not a cure, it's a baseline requirement. Deficiency correlates with risk. Megadosing doesn't cancel it. Vitamin D supports immune regulation and cellular control. Important, not sufficient alone. The goal isn't more, it's adequate, often around 40 to 60 ng/ml, individualized. Too low is a problem, too high raises calcium, precision beats hype. Very low calcium intake is linked to higher colorectal cancer risk. Supplement trials show modest reduction in polyp recurrence. Calcium binds bile acids. Adequate helps, excess does not. Food first. Dairy, fortified foods, leafy greens. Protein isn't the issue, pattern is. Processed meat carries the strongest risk signal. Bacon, sausage, hot dogs, deli meats. Daily intake shifts risk upward. Processing adds nitrosamines. Fish, legumes, yogurt, poultry, different pattern. Frequency shapes biology. The most powerful intervention? Movement that can lowers risk. Regular physical activity is associated with 15 to 25% lower colon cancer risk. Sedentary behavior raises insulin. Inflammation, growth signals. Exercise lowers them. In stage 2 and 3 survivors, structured exercise reduced recurrence and mortality by over 30% in randomized trials. Brisk walking, several hours per week. Every day you move, you change the terrain. Fermented foods influence the microbiome. Sauerkraut and fermented vegetables support colon lining integrity and modulate inflammation, not treatment. Environmental shift. Colon cancer follows patterns, so do outcomes. Screen on time, move consistently, eat with intention. I'm Afsoon. This is education, not personal medical advice. If this helped, like, subscribe, and share. Prevention works when you act early.